Joining us now, we have Jane Weber, who is head of the Women's Veteran Program here in Albany, New York. It's a program which is available to women veterans throughout the United States of America. Jane, nice to have you with us.
Thank you very much for having me.
Now, could you explain what the Women's Veterans Program is? It's relatively new in the VA, right?
In the formal sense, yes. There have always been women at the VA,
right,
kind of scattered and peppered throughout the VA. But as the number of women veterans is increasing, the awareness of the needs and the changing needs of our women veterans has come to light, and we are doing everything in our power to make our programs keep up with those needs.
Well, you were talking before we went on the air today how the role of women in the military has changed since World War II and the Vietnam, and how it's different today, and thus the needs of women who are veterans are different. Could you explain that a little bit to our viewers?
Yes. Typically, from the Vietnam era going all the way back, women took a less active role in the sense of being on the front lines and being in combat. And women were more often in the roles of nurses and secretaries behind the lines, and were not subject to the combat stresses that we see our younger female veterans being subjected to. The women who came back from those earlier conflicts had a profession, typically came back and had a job with very often benefits, health benefits, and were seen in the private sector for their health care. So we're not using the veterans' benefits as readily as their male counterparts. And also, traditionally, even up until the very present time, women veterans don't always see themselves as veterans. They don't realize that they're eligible for the same care as their male counterparts.
Why is that?
Because I think there's just a connotation to that term veteran, that it's for men, and that's held on even to the present. So we're trying to educate all veterans, especially our women veterans, that they too are eligible just the same as their male counterparts.
Well, I know during the Bataan Death March during World War II, women were captured by the Japanese and sent to prison camps. And how is the need of the veteran of World War II different from the need of the veteran of women veteran of today? Because they were in combat to a degree, I mean, being a prisoner of war, but today's veteran, actually women veteran now carries a gun. That's the difference, and thus the needs are different?
True to some degree, but I think the larger issue is the numbers now. What you're talking about in Bataan, although these people deserve everything they can get in terms of health care, and including behavioral health care, which is so key and so important for people that have had these battle stresses, the sheer numbers now are different. There are so many more women that are in service in the capacity of having a gun in their hands and being on the front lines.
For women veterans watching right now, what are some of the services that you can offer them that they should be aware of that they may not be aware of?
There has been a whole change in the delivery system of healthcare to women that started about 2.5 to 3 years ago. The definition of primary care in the VHA changed. Generally speaking, when women came in to see their primary care provider, all of their medical issues were managed except that which was gender specific. And they needed to have separate appointments with a gynecologist, even if they were well. Not that they had a problem in that area, but that they were just having their basic routine care. They were seen in separate visits, which meant multiple visits, and just the difficulty of coming in to be seen at different times, appointment scheduling, taking time off of work. We're trying to consolidate that, and the definition of primary care for women has now changed to comprehensive primary care, which means that it's kind of the one-stop shop, that a woman can come in to receive her primary care from her personal primary care provider, who is a constant. It's always the same person, and that provider will be able to also provide the gender-specific portion of her care. In other words, pelvic exams, breast exams, pap smears, it can all be done in the context of a primary care visit, rather than that woman needing to make a separate appointment.
And again, the Veterans Administration, although we're talking about what happens in Albany, what happens in Albany happens in Syracuse, happens in Buffalo, and throughout the United States of America, right?
Absolutely. This is national mandate that these programs are set up, and while there will be slight variances from one VA to the other, generally speaking, we're all under the same guidelines, so these programs are available to every female veteran across the country. When
you see women coming back from Iraq or Afghanistan, how are they doing compared to the men, or basically are the issues pretty much the same?
Most of the issues are the same. The difference being coming into the VA, which is still predominantly a male male-dominated facility in terms of the numbers, it's a strange environment. And if women are having issues requiring a little more sensitivity and privacy, for instance, women who've experienced military sexual trauma, the need for a separate environment where they can be a little bit more sheltered from the overall VA exists, and we are recognizing that and doing something about it.
Could you elaborate on what military sexual trauma is?
Military sexual trauma is any unwanted sexual advances that can range from verbal abuse or innuendo all the way across the gamut to actual rape of a soldier.
The things which unfortunately happen in traditional society as well.
That's true.
Now, also I assume to a degree, because I know in Iraq and Afghanistan, women like men have been POWs, and I would assume that maybe they've been victims of that in a POW situation as well?
Yes, but the unfortunate part is, by and large, when this happens, it's happening under friendly fire, if you will. It's happening within the confines of their military service, and it's their trench mate, if you will, the person next to them. It's somebody who can be just on assignment with them. It can be a superior. It's just a very difficult situation because these are the people you trust and to have your back, and when that happens, it's really particularly difficult to deal with emotionally.
What are some of the other contemporary issues unique to women veterans today that we might not be aware of?
The age dynamic has changed. Not so long ago, the average age of female veterans coming into the VA was 60 years old. Now the average age is 40, and the fastest growing group of women are between 20 and 30. So that changes the entire dynamic. You were dealing with women who were seniors, who were looking for postmenopausal care, nursing home care, and adult medicine care, and suddenly you've got family planning issues, obstetrical issues, all the gamut of behavioral health issues that we've always been aware of, but with the particular stresses of these current conflicts, that too has to be addressed, and we are doing that.
What kind of feedback are you getting from the women veterans who are your consumers? What do they find special about a program and say to you, like, wow, this is really great, we didn't know this was going on? Because you might inspire some of our viewers this morning to take advantage of your programs. We've
done some really great things recently in terms of the manner of providing services to our women veterans. First of all, we have a whole center, it's a women's wellness center that's going to be opening shortly, we think next month in October, where women can come for their primary care and their gender-specific care, specialty care, gynecologic care if they need to, as well as behavioral health, all in one area. We now have a designated women's health primary care provider, a female physician who is preferentially being assigned the new women veterans coming back from Iraq and Afghanistan. She's particularly sensitive to the issues that these women have faced and can get them connected with the behavioral health services and any other specialty services that they need, just because they've been through what they've been through. And we used to have gynecologic services from Albany Medical Center. We now have our own gynecologist, so it's consistent care from a consistent face, and that's what women are liking. The fact that there is a physician there that they get to know, who gets to know them, is vested in their care, and we now have an actual whole team with nurses and people who get to know their patients, and there's a lot of consistency now. Women like that. They were not comfortable with the rotating of physicians. Their medical care was great, it's just that they weren't always getting the consistent faces there, and women like that. They want to see the same providers and know that that provider is interested in them.
I know you can't speak for every veterans hospital in the United States of America, but I'm going to ask you to anyway. Isn't that special, Joe? Can generally, like a traditional hospital, can women that are experiencing a problem go in anytime, 24 hours a day, 7 days a week, or do they have to set up an appointment with the Veterans Hospital before they can go for service?
With regard to routine primary care or specialty care, you do need to set up an appointment, and we have people who are trained to decide what care you really need and have you see the appropriate provider. But we do have an emergency room And veterans who are in need of emergency services 24/7 can come in at any time, no appointment, just walk in and receive the services that they need on an emergency basis, with then the follow-up set up for them with either their routine primary care physician or gynecologic specialty care if that's what's necessary.
Okay, we're just about out of time. If there is one thing that you could say to our women veterans watching today to encourage them to use your services, what would it be?
Come in, enroll, come for the services. You earned them. They're here, and we are ready to take care of you.
Well, Jane Weber, Program Manager of Women's Veterans Program here in Albany, New York, I want to thank you very much for joining us. And again, we want to stress that this is a veterans program for everyone in New York State, and everyone, if you have to be vacationing here and you're from Alabama, it also is applicable to you folks in Alabama. Thank you for joining us.